So Alan Marlatt was from Canada and came to, well, he was at a number of places, but was at the University of Washington in Seattle for many years. And that's when I met him and worked with him. I was an undergraduate student at University of Washington, wrapping up my bachelor's degree working in an autism lab, wanted to get a job in that lab, and they didn't have any jobs, but Alan happened to have a job in his lab. I really knew nothing about him at that time and came to find that he's a really prominent addictions researcher. And I thought, well, this is a really important topic. This was Seattle in 1990. And I happened to have a lot of people I knew in my life at that time who were becoming involved with alcohol, drugs, all kinds of things. So I thought, well, this is a good opportunity to really learn about this. And this became my career. I'm still working in the field of addiction.
And so, how long did you work with him? You want to tell me a little bit about your time working directly with him, and then we could kind of transition into some of the things you did after.
I worked with Alan for 3 years, from 1990 to 1993, as a full-time kind of program coordinator, research assistant type of a post-bac kind of a deal. And at that time, Alan had several projects going on. He, of course, his relapse prevention book, which he's very well known for, had already come out, and that was a really groundbreaking book that identified common precipitants of relapse and kind of describe the process of how one goes through relapse. So that was already established. There was a lot of work that kind of stemmed from that and really understanding the process of relapse better. And he also had a number of college drinking projects going on at that time. Some of them were more of an assessment nature, surveying college students and in the Greek system and the dormitories. And then there were some other kind of brief intervention programs designed to reduce drinking for, especially in the Greek system when there was a lot of really heavy drinking happening there. So it was really interesting to be part of those studies and kind of help facilitate those and sort of help run the lab. I kind of was the assistant to the main person who ran Alan's lab. So I was like a fly on the wall in all these interesting meetings that Alan helped to facilitate.
Can you talk a little bit about how that informed what you did after you left Alan's lab? And I mean, obviously, there's a lot of continuity with what you're doing now and what all the way just after undergraduate you were doing. And so presumably it was a pretty formative experience in that respect. Can you kind of tell me a little bit about what was the next step and how Alan may have influenced that a little bit?
Alan was very formative in my interest, first of all, in just wanting to pursue a career at all and go to graduate school and kind of understand how that would work, what it's like if you kind of pursue an academic career path. And he was a great example of how that can be incredibly enriching and how you get to interface with a lot of other people, which he did so well and facilitated in several different ways. The specific areas of addiction that I ended up working in were a little bit more focused on the brain and brain imaging, which I learned about later. But kind of learning how to bring different people, different kind of talents together was certainly something I learned from that time, seeing how Alan did that.
For some labs, being an undergraduate or a research assistant at that level, you don't get actually a lot of interaction with the PI, especially if the lab is big and the person is very prominent. And but it sounds like you did. And was that unusual at the time? Did you recognize that as a unique and valuable situation for yourself, or what I guess the question is, how much awareness did you have at the time, and was there at the time that this was actually very like hands-on mentorship you were kind of receiving?
Yeah, I think having worked with several different prominent faculty types a little bit over the years, Alan was very special and unique in that he treated everybody very similarly, with a similar amount of respect and interest. And at the same time, he had a lot of friends and contacts. He had a kind of a program where he would bring various faculty to visit the lab at the University of Washington there for a term. So I got to help like find their housing
Oh, wow.
and kind of help facilitate them coming in. So that was a really neat program to be part of. He had a T32 fellowship, so there are a lot of different kind of trainees rotating through. And then he had a lot of graduate students and postdocs who were there. So I got to like take minutes at some of the lab meetings, and which meant I got to be there and listen to all these really interesting discussions, including when like Lorraine Collins was there, Saul Schiffman, Bill George, just really fascinating people in the field, interfacing with Alan's lab, these rotating bases.
Such a cool opportunity. That's great. Okay, I'm going to check my notes and make sure I'm on track instead of just going directly off of the conversation. So, what would you say? I mean, I kind of already have a hint of it already, but what do you have any like big top ticket items where you'd say this has been the impact that Alan had on my career as a whole? Do you have like, is it been just sort of those small pieces in the beginning to help you get your career started, or are there things that even there was, after you left your time actually working with Alan that impacted you? Maybe things he published that changed what you're doing in your work, or I don't know what they could be, but do you have kind of idea of like the impact he had?
Yeah, I think it was his ability um, to look to people who were certainly like way junior to him, as I knew nothing about anything yet, but I had a few interests and sometimes would ask questions, and he would take such an interest in what other people were observing kind of in the world. So I was involved with needle exchange in Seattle at that time, and thought this seemed like an important thing to do at that time in the early 90s. There was a lot of HIV transmission happening, especially amongst injection drug users. And he had such an interest in this kind of hobby that undergraduate in his lab was doing, and I thought that was so nice that he was interested in that. And he then also went to be very interested in a whole array of harm reduction approaches, and that sort of gave me a conceptual framework for what some of these approaches were like, and what they were doing, and how they were kind of viewed as somewhat controversial at that time, very controversial and even illegal in some cases. Alan went to the Netherlands for a period of time and kind of learned more about different harm reduction approaches, brought that back, got a contract from, I think, Guilford to write a book. I was able to co-author a chapter or two in there, which was a fantastic opportunity at that time for me, and just kind of learn much more broadly about ways to help people at where they are, and maybe through that contact effort, work with them and bring them into, an array of services and ways to improve their health status.
That's great. What kind of, sounds like the same answer could be said to the question I'm going to ask next, but what about the impact, Alan's impact on the field overall? I mean, I know his harm reduction contributions have been really a huge portion of that, but do you see anything else? I mean, I've gotten the impression that also he was a little bit of a boundary pusher, and that was very good for the field. Can you kind of speak to those kinds of things and how that may have impacted the field as a whole?
Yeah, I think Alan would put a lot of thought into something, and if making it happen required kind of pushing some boundaries, being a little bit controversial, he was up for doing that a lot more than many people in the field at that time. So it was always fun to see how he would do it. He would do it in a very kind of a way. So he was not confrontational with anybody, but he would kind of, raise a few ideas that some people certainly viewed as controversial. And I think it was good for the field to kind of push down some of these barriers and think about things from a somewhat more fresh perspective.
Did he ever, to your knowledge, did he ever experience like actual conflict or pushback that was, professionally or personally disruptive? I mean, the level of provocative ideas, who's providing, some people, as we know in the field, kind of really dead set on their own stance, and sometimes that can cause a fracture in professional relationships and things.
I think, yeah, he did. There were several different things over the years. Some were like before I was working at his lab that had to do with the controlled drinking controversy, and I think he was standing up for folks who were kind of involved with that. I think during the time that I was with him, it was around the time he was doing a lot with harm reduction, which ranged from helping people in the Greek sorority and fraternity system reduce their drinking to street outreach with injection drug users. And I think he had a really open mind and very accepting, but he would push back on like the county officials or different people in town. There was like somebody involved with one of the churches. I can't remember the details, but someone involved with one of the churches in Seattle, I think, who was very opposed to these approaches. And I feel like they had like, op-ed battles or something like that. I can't quite remember the details, but
we should dig those up.
Yeah, there may be something there, Father Roy or something like that. But so he was not at all afraid to kind of go to battle with some of these figures who were like, no, we must do things in the same way. How dare you give needles to someone who's using drugs and that kind of stuff. He would very much push back on.
Oh, that's cool. That's precious. Oh, that's great. Let's see. Gosh, we already have hit on so many of these things. I just asked them in a slightly different way. Oh, this is a really good one. So, as you know, RSA has the Marlatt Award, which you have received. And so it's clear that Alan was a really excellent mentor. Can you speak? I know you've touched on it a little bit, but what his mentorship style really was that precipitated him to have a whole award named after himself, and then how what are there features of his mentorship style that you carry as well? Because all I hear about you is that you're a fabulous mentor, and so many mentor awards, so it must be true. And so what's the interplay there between Alan's mentorship style and your own?
I think learning his style of mentorship is probably something that I picked up more than anything else from him, really. Just the way he treated everybody with such respect and interest. He involved everybody. There wasn't a hierarchy. He expected excellence. He really wanted people to do well, of course, and to be productive and to write well. He was a great writer. He gave really helpful feedback about how to structure a message and how to kind of sell a model, for example, which I think has been really helpful in communicating. He did a lot of things in mentorship. He created some specific programs to help just facilitate and sponsor mentees at various levels, undergraduates all the way to faculty. He did a lot at the individual level to really, be a sponsor and advocate for people he was mentoring, to really reach out to other contacts he had in the field, see if there's opportunity for somebody who's working with him. He had a lot of mentees. I mean, just a growing umbrella of people who he was involved with, facilitating their career. And he had a great way of connecting people together and just creating a really warm environment that didn't have tensions or competitions or hostilities, that because it was really fun. He really made it fun to do science, to be part of academia. He had a lot of great parties. They're very fun, lots of good times at the parties. He would take something that I should do more of, actually, is he would take a retreat, and like set aside a day a year for the lab to go and really plan in greater detail, get away from all the, the phone ringing and all that kind of stuff, and just really plan things from a deeper perspective, which I think is a good thing that I should do. But I think what I've learned though from him is to try to just be there as much as you can for each person who you take on as a mentee, and really think about what's going to be the best for their career and what's going to be most interesting and rewarding for them.
That's great. Um, let's see. What do you think Alan would see as the present day largest outstanding gap, or missing piece to the puzzle that would be the real greatest priority to be working on right now? I know that's a hard question to answer,
It's
but
such an interesting thing to think about. Um, one, I mean, I think Alan always wanted to make sure that people who were struggling with addiction had access to what they need to achieve their goals, and that continues to be a big problem. If he were still in Seattle, as in many cities in our country, there's a lot of people really, really struggling with housing, with getting services for for addiction, for what they need to get their life to a more stable level. And I think he would probably be very upset about that and advocating for better things, and maybe at the local level, maybe at the national level. Um, I think he would want, more funding for NIAA.
yeah, as we all do. Thank you, Alan. I appreciate it. So I now having a brain fart, and I can't remember if it's Seattle or Portland that this is happening in, because I get the two cities confused. But one of these two cities just passed this bill that allowed street use of um, illicit opiates, and there's been a big problem with this, because now everybody wants this bill walked back because for apparent ineffectiveness and causing all of these other issues related to drug use in the streets and safety concerns. And I'm just wondering, hearing what you've already said about Alan, do you think that he would have been involved in that kind of work, and um, involved in the origin of the bill as it was, and then perhaps the response to it now? Do you kind of see that as something he would have been involved in?
Yeah, when that was coming up in, wasn't it like 2020 or so that passed, I think.
Yeah, it was, and I think that part of the issue is that people think COVID is really part of what disrupted its efficacy, because it sounds like only half of the bill sort of came to fruition. The other half, with the resources part, didn't actually happen,
kind of
right?
thwarted. Yeah. So
that was COVID that disrupted that.
I think so.
Yeah. So I think you're right. It was about 2020.
Yeah, I mean, I think Alan would have been really, the last interactions that we had when I was there, kind of in the 90s when we were working together, was certainly on advocacy for really dropping a lot of the laws that produce additional harms to people who are struggling with various substance issues.
Mm-hmm.
And I know he was really interested in, somewhere in Switzerland, there was this park where heroin was made to be, it was allowed for use. There was a safe injection site in Vancouver, British Columbia, that he visited a number of times, and a few other places who were kind of experimenting with really dropping the laws around drug use. So I'm sure he would have been supportive of this law, at least to see how it played out in Portland. I've heard dialogues on both sides of evaluating how it has gone, and the people who were advocating for it, are feel that the consternation against it has been a bit unfair and a bit too soon, because some of the programming was thwarted by COVID and other kind of impediments at that time. So it wasn't able to play out as kind of
originally planned,
intended. So I would imagine that Alan would be advocating to give it a little bit more time and see how it really can work.
Did you keep in touch with him throughout your career, or did you really sort of move on after you left his lab and only see each other periodically?
Yes, I would see him. Gosh, we usually would be able to connect at least once a year. So for quite a few years during the time that I was in graduate school in San Diego, and it probably was less contact gradually over time, but I still was able to see him, and you know, he was just such a wonderful person in my life to check in. And, how are you doing? How do you like in graduate school? And what is it like? And he was just really supportive. And we were still working on some chapters about harm reduction, which was really fun to have that opportunity to keep working with him. I think it was uh, 98 or so that was published. And yeah, so we probably had a little bit less contact in the years after that. But if I had the chance to see him, it was just
good opportunity
to be able to,
That's great. What else do you want us as the alcohol research community or the public at large to know about Alan, either about him as a person or his scientific contributions or legacy, anything else we didn't really touch on that you think is important that we should know?
He brought a lot of fascinating, talented, brilliant people together who are from all different kinds of backgrounds and perspectives and training areas. Um, so a lot of just my favorite people in the field are people who I met through his lab, people who I didn't interface with, who worked with him later. But there's sort of this common bond of having worked together with Alan that we all kind of, feel and perceive. So I think there's some just incredible people in our field who I know that he was so, proud of. Like Katie Witkowitz is a great example. He was so proud of her, and I know would be just thrilled to see what she's doing now.
That's so great. Anything else you want to add or talk about that we didn't get to? I feel like we touched on most of the things I had on my list, but we still have.
He had great slides.
Oh yeah,
he had fantastic presentations. He was a really fun, charismatic presenter.
Oh, cool.
He had some sort of somewhat racy slides.
Oh really?
There were people in the audience like, but
racy in what way? Like telling political jokes or?
Kind of, yeah. He would push a few boundaries like that. He had something about like beer goggles that was showing. It was kind of demonstrating the effect of when we drink alcohol, how people might appear sexier or something like that. He had some slides that kind of demonstrating that effect. But yeah, he was a fantastic presenter. The room was usually pretty packed when he was giving it.
Cool.